Rebecca asked what some of the barriers were, we wanted to shift gears and kind of talk about some strategies for advocacy. So we have a booth upstairs where we're trying to talk to passerbys about, every time someone asks and they saw our Florida State sign, they asked us about admissions, and we said, no, we're not here for admissions, but we are here to let you know that if you work in a behavioral health site, there's a program specifically designed for patients who have a mental health or substance abuse disorder that is specifically geared towards that population. So you see all the tobacco-free Florida signs and advertisements. Those are more geared for the general population. So as Rebecca was saying, we know that this population smokes cigarettes at a higher rate, so they need more intensive support and services in line with more frequent tobacco cessation classes and more NRT. And so when we were sitting down thinking of how we can best make inroads into behavioral health organizations, we know we need to gain administrative support. So, if you work in an organization, everybody has to be on board for something new to get off the ground. So we want to gain administrative support from the top so that the message reaches those who are doing intake and reaches those who are actually doing one-on-one counseling with the clients or patients at a facility, those who are creating the treatment plans and so forth. And so the first, we want to ask all clients at every visit about their tobacco use status. That's something that is happening at a regular health clinic, and we want to make sure that this is happening in a behavioral health facility, that every patient that comes through the door, that they're asked about their tobacco use. And why do we need to know that? You can't help them if you don't know who the tobacco users are. And then you want to, once you ask them about their tobacco use, everybody in this facility should be trained to advise them to quit smoking, quit vaping, whatever product that they're using. And if you can make it personal, make it personal. If you quit smoking, you're gonna feel better. If you quit smoking, you'll be able to receive housing, because a lot of apartment and rental places say, well, you can't smoke inside. So you have to make it personal to whatever it is. If they have asthma, that they're gonna breathe better. So whatever it is, when you make that advisement statement for them to quit, make it personal to them. And then you wanna offer support, treatment, and medications. And those support methods would be a tobacco cessation class or NRT medications, which we know is nicotine replacement therapy, and it comes in the form of patches, gum, or lozenges, and it's free to everyone that's in Florida. So those services are free, and those patients have a right to know about those services and know that they exist. So, and we also want to include tobacco use on the problem list. So, and incorporate it into the treatment plan. So everybody at the facility knows that patient John is a tobacco user. He has been advised to quit. So every time he comes, this conversation is happening. And sometimes we get sidetracked where people will say, oh, I don't want to seem like I'm badgering them or making them feel a way about it. And we remind them, every time you go to a doctor's appointment, no matter what, they're gonna ask you to get on the scale. A lot of times I don't wanna be weighed, but they're gonna ask me, and you wanna remind them that it's included as part of a vital sign check. That's just something they're gonna learn to expect when they come to this organization, they come to this facility, that they are gonna be asked about their tobacco use, and they are gonna be advised to quit. And it's gonna happen every time. And facilities learn that once this is ingrained into their approach, then you start to see that systems change. So FSU AHEC has been given a special assignment to try to reach behavioral health facilities and we know that they're in an excellent position to promote healthy lifestyles, right? And we want to decrease unnecessary death and disability due to tobacco use. And again, Rebecca already referenced that a lot of patients that have a mental health diagnosis or a substance use diagnosis, if they die or they get sick, it's usually due to a disease from tobacco use. It's usually cancer or a heart attack or like I said, cancer or emphysema, something like that, that's attributed to their tobacco use, but not their mental health diagnosis. And so how FSU AHEC can help is we can come in and provide that technical assistance. We can come in and provide that training to the staff at the behavioral health facilities to help them promote tobacco control initiatives to behavioral health organizations across Florida. We also have a behavioral health committee that consists of tobacco cessation facilitators all across the state, because that's one thing with the tobacco cessation in Florida is represented in all 67 counties. So every month, all of these tobacco facilitators get on a call that are working with behavioral health organizations in Florida. We get on a call, it meets monthly, and we talk about challenges that they're facing trying to implement systems change in these behavioral health organizations, how they can overcome barriers. We also share success stories, because there are a lot of success stories at our table upstairs. A lot of people were stopping by our table saying, oh, we have tobacco cessation at our facility. Our AHEC is coming, our local AHEC is coming monthly or once a week to provide cessation classes. And that's the kind of thing we want to hear.
Can I add something too?
Yeah, go ahead.
I just want to point out that I think that we can pretty easily take behavioral health professionals and teach them about tobacco and equip them to go out and save lives. But it's much harder to take people without a behavioral health background and get them equipped to be working in the behavioral health field. So the more people that we can get that are already living and breathing this to be, on our side and advocates, I think the better the program and all the people we're serving here in Florida are going to be.
Great, thanks, Reggie. So we know that systems change work is hard, and it's not an overnight process, and it is a partnership with the partner sites. So we have a thing which is called an initial follow-up, where we come into a behavioral health organization and we go through the questions and we ask them, because they are the experts on their facility, how can we help? What is it that you want? Are you trying to go tobacco-free as a facility? Do you just want to have cessation classes for your employees? Do you want to have cessation classes for participants and staff? What is it? How can we help you? And then we meet with them and we talk about their this initial systems change form, and we decide what they want to work on for a year. And then we follow up with that same form annually to see the progress that was made. And like I said, it could be different things. Like some want to work on tobacco policies, some want to just do the very basic where they have a system in place that identifies their patients who are the tobacco users in their facility. So we have a program called Community of Practice, and we have it every year where we try to find 6 to 8 behavioral health organizations that is willing to meet and create this community of practice. So who's heard of a community of practice in here? So in this behavioral health community of practice, like I said, each year we look for 6 to 8 key champions from a behavioral health facility who agree to work in this community of practice. And in this group, they share concern or passion for what they want to work on. And ours, of course, is something related to tobacco. It's either a policy or creating, a brief intervention at their facility, so whatever it is, and everybody they work individually on their plan for their facility, but they come together to share ideas, so.